final thoughts. Carolyn, you led us off this afternoon. Perhaps you want to be the first to give us a few of your final thoughts, if I can get my words out properly. Sorry about that.
I think the final thought should be we all need to think about self-care. As has been talked about throughout this program, we are usually focused on other care, our clients, our colleagues, our family members, but particularly in this challenging time, without self-care, we can't really help others or care for others. So I think that's a really important part of what we need to do. And I also encourage those around us to be mindful of what to look for and to intervene early. We know that early intervention and being proactive when we're addressing issues of mental health really makes things more successful down the road. So it's important to keep that in mind as well. Thank you. And thank you all for participating, my colleagues in this program, as well as those of you who are participating out there. Thank you.
Thank you. Thank you so much, Carolyn. Crystal, a few key takeaways from yourself as well.
Yes, for me, I would just say be sure to stay in tune with your own mental health. I think it's really important that you realize that you're always on alert for everyone else, and it's important to stay on alert for yourself and make sure that, like all of my colleagues said, get in that self-care that is absolutely necessary. It's not even a luxury anymore. It's absolutely necessary. Don't be afraid to reach out for help. Mental health symptoms are so common that there should not even be a stigma associated with mental health. And so I want you to feel absolutely comfortable reaching out to make sure that you get the help that you need. So thank you so much, Carolyn and Mark. You did a phenomenal job. I'm so grateful to be serving on this panel with you all. And to the Knowledge Group, thank you for having me. This has been an amazing experience. Thank you.
Thank you so much, Crystal. And then we heard from Mark. Mark, perhaps you want to close us out with a few of your final thoughts.
I was just going to have a really simple final thought, besides thanking the Knowledge Group and my co-panelists for their amazing jobs, is be nice to yourself and be nice to everyone else. One of the things that we need to do is be nice to our colleagues and seek to understand why they may not be in an optimal mind state. Maybe they have a husband at home or a wife at home that isn't used to being home, and they're schooling their kids, or they have kids with illnesses and the dilemma whether to send them back to school is really weighing heavily on them, or they're just feeling lonely and isolated. Just be nice. Ask human questions and be a good friend and a good listener.